What's up, EMRAP universe? I'm out here in Fresno, California, and it's a mild 98 degrees Fahrenheit, and I just went for a jog. So what am I at risk for? Heat illness. I'm Jessie Werner, and this is your Daily Dose. Now I am in a shaded spot. I was able to cool off in some cool water. I have a cool drink, and so I'm treating heat illness appropriately. And there's lots of different varieties of heat illness, if you will. It can really run the gamut from heat edema or heat cramps or heat syncope at the lower end, all the way up to heat stroke at the higher end. A few things we think about, as I mentioned, exertional heat illness. So that's a young person who's outside, usually exercising, playing football, running in the heat, and they become overheated and may have some nausea, vomiting, some altered mental status. If they have altered mental status, that moves them up to heat stroke. But the cause of their heat stroke is an exertional heat illness. And this is different than something like a classic heat illness. And that usually happens in older people who are at risk for these kinds of things. They can't cool themselves off quite as well, or people who just can't get access to a cool environment. So classic heat illness, that's usually someone who's living in a house that doesn't have air conditioning and they're sitting and becoming overheated. Now, other things you need to think about, heat exhaustion. So sort of what's the difference there? In heat exhaustion, a lot of times you'll start to see some tachycardia. You may have normal blood pressure, or you may have hypotension, and the temperature is usually a little bit elevated. Again, once you get to heat stroke, the definition of that is altered mental status and a temperature greater than 40 degrees Celsius. So what are you going to do for these patients? Well, in the mild forms of heat illness, it's just what I said. They need to get out of the sun, they need to get to a cool area, they need to change their clothes, get into a cold shower, drink some cold water, and take a break from whatever exertion that they're doing. When you get into the more severe forms of heat illness, and definitely heat stroke, you need to cool those patients off very rapidly. And the best form of cooling is to get them into a cold water immersion. So if you're outside hiking and there's a big lake or a pond, just walk that person straight into that water source. Now, if you're in the emergency department, sure, a cold water ice bath immersion is ideal, but a lot of times we can't do that. And so evaporative cooling is probably your next best bet. And you're going to take the clothes off the patient, you're going to cover them with wet, damp towels, you're going to spray them with water, you're going to get a fan on them, and you're going to try to cool them down. And what's the goal temperature? You really want to get them down to about 38 degrees. So those are my big tips on heat illness. I'm Jessie Werner. That's your Daily Dose.